Hello everyone, myself Sapnali Nayak from Christo Jayanti College, and today I'm going to brief you all about factitious disorder and malingering. So first I will talk about factitious disorders. So factitious disorders are conditions in which a person deliberately and consciously act as if they have a physical or mental illness when they are not really sick. People with factitious disorder deliberately create or exaggerate symptoms of an illness in several ways. They may lie about or fake symptoms, hurt themselves to bring on symptoms, or alter tests, such as in contaminating a urine sample to make it look like they or the person in their care are sick. People with factitious disorders behave in this way because of an inner need to be seen as ill or injured, not to achieve a clear benefit such as financial gain. People with factitious disorders are even willing and sometimes eager to undergo painful or risky tests and operation in order to be obtained the sympathy and special attention given to people who are truly ill or have a loved one who is ill. Factitious disorders are considered mental illnesses because they are associated with several emotional difficulties. Many people with factitious disorders also suffer from other mental conditions, particularly personality disorders. People with personality disorders have long standing patterns of thinking and acting that differ from what society considers usual or normal. Also, these people generally have poor coping skills and problem forming healthy relationship. Factitious disorders are similar to another group of mental disorders called somatoform disorders, which also involves the presence of symptoms that are not due to actual physical illness or another mental illness. The main difference between the two groups of disorder is that people with somatoform disorder do not fake symptoms or mislead about others about their symptoms on purpose. And there are four types of factitious disorder. The first one is with mostly with psychological symptoms, as it is a psychological symptoms. The first one, people with this disorder mimic behavior that is typically a mental illness such as schizophrenia. They may appear confused, make absurd statements, and report hallucinations. The experience of sensing things that are not there, for example, like hearing of voices. The second one is with mostly with physical symptoms. People with this disorder claim to have a symptoms related to other physical illness, such as symptoms of chest pain, stomach problems, or fever. And the third one is both psychological and physical symptoms. People with this disorder produce symptoms of both physical and mental illness. And the fourth one is not otherwise specified. These types include the disorder that called factitious disorder, and people with this disorder produce symptoms of illness in another person under their care. And now the symptoms of factitious disorders. Factitious disorder symptoms involve mimicking or producing illness or injury or exaggerating symptoms or impairment to deceive others. People with this disorder go to a great length to hide their deception. So it may be difficult to realize that their symptoms are actually a part of serious mental health disorders. They may continue with the deception even without receiving any visible benefit or reward, or when faced with objective evidence that does not support their claims. Also, sometimes they may be very dramatic but inconsistent medical histories, unclear symptoms that are not controllable or that may become more severe or change once treatment has begun. Then presence of many surgical scars, appearance of new and additional symptoms following negative test results, um, predictable relapse following the improvement in the condition, extensive knowledge of hospitals and other medical terminology, as well as the textbook description of illness. So, talking about the cause of factitious disorder, the exact cause of factitious disorder is not known, but the research has been going on this role. And the researchers are looking at the roles of biological and psychological factors in the development of these disorders. Also, some of the theories they suggest that a history of abuse or neglect as a child, or a history of frequent illness that required hospitalizations may be a factors in the development of this particular disorder. So now talking about how common the particular disorder is. So it has been found that it is more common in men than in women. However, the factitious disorder by the proxy tends to be more common in women than in men. So now talking about how those with factitious disorders fake illness. So because like people with factitious disorder they become very expert at faking symptoms and disease or inflicting real injuries upon themselves, and it may be hard for the healthcare professionals or the loved one to know if illness are real or not. So people with factitious disorder make up symptoms or cause illness in several ways, such as like exaggerating their existing symptoms, like even when an actual medical or psychological condition exists, they may exaggerate symptoms to appear sick or more impaired than is true. Making up histories. They may give loved ones, healthcare professional, or support groups a false medical history, such as claiming to have a cancer or AIDS or etc. Faking symptoms. They may fake symptoms such as stomach pain, seizure, or passing out. Causing self harm. They may make themselves sick, for example, by injecting themselves with bacteria, milk, or etc. They may injure, cut, or burn themselves. They may take medications such as blood thinners or drugs for diabetes or to mimic disease. Now let us see like when to visit a doctor. So people with factitious disorder may be well aware of the risk of injury or even death as a result of self-harm or the treatment they seek, but they can't control their behaviors and they are unlikely to seek help. Even when confronted with objective proof, such as a video tape that they are causing their illness, they often deny it and refuse the psychiatric help. If you think a loved one may be exaggerating or faking health problems, it may uh, it may help to attempt a gentle conversation about your concern. Try to avoid anger, judgment, and confrontation. Also, try to reinforce and encourage more healthy, productive activities rather than confusing or dysfunctional beliefs and behavior. Offer support and caring, and if possible, help in finding treatment. So there are some risk factors which is associated with factitious disorders. Some risk factors are like childhood trauma, such as emotional, physical, or sexual abuse, then a serious illness during childhood, then loss of a loved one through illness, etc. Past experience during the time of sickness and the attention it brought, then poor sense of identity or self-esteem, depression, personality disorders, then desire to be associated with doctors or medical centers, etc. So now talking about malingering. So when you were a child, did you ever pretend to be sick to get out of going to school? There is actually a medical name for this particular behavior. It is called malingering. It refers to producing like fake medical symptoms or false medical symptoms or exaggerating existing symptoms in hope of being rewarded in some way. For example, someone might pretend to be injured so they can collect an insurance settlement or obtain prescription medication. Others may be exaggerate mental health symptoms to avoid criminal convictions, or more specific examples of malingering include like putting makeup on your face to create a black eye, adding contaminants to an urine sample to change its chemistry, placing a thermometer near a lamp or in a hot water to increase its temperature, etc. So talking about some symptoms of malingering. So malingering does not have any specific symptoms. Instead, it's usually suspected when someone suddenly starts having a physical or psychological symptoms while being involved with a civil or criminal legal action. So, what causes malingering? Malingering isn't caused by any physical factors. Rather, it's the results of someone's desire to gain a reward or avoid something. Now, talking about both factitious disorder and malingering. Factitious disorder and malingering are two variations on a similar theme. Both involve people who exaggerate or make up symptoms of an illness, and this also means that the treatment is different. Malingering itself, it's not a mental illness in some cases. However, people who adopt malingering behavior do have a mental illness. One example is associated with antisocial personality disorders. Individuals with disorders often exploit people and laws for personal or financial gain. This can be included with malingering behavior. So, how the diagnosis can be made for both the factitious disorder and the malingering? So, it can be very hard to tell the difference between factitious disorder and malingering, and it can also be very hard to distinguish this from the real illness. At least initially, it can be seen that the patient is ill. However, there are signs that point towards someone faking or exaggerating an illness. These signs may not be seen right away, but it can be noticed as a pattern over time. So, some signs of factitious disorders are medical history that includes one or more of the previous serious or dramatic illness, and medical history like seeking treatment with different doctors at different hospitals or clinic. Some of the signs of malingering, which includes a previous diagnosis of antisocial personality disorders and refusal of an appropriate treatment of the illness they claim to have. So now talking about the treatment of factitious disorder, there is no known a single treatment for the factitious disorder, but the researcher have found that psychotherapy it's effective for the factitious for the patients who is diagnosed with factitious disorder. Like psychotherapy and behavior therapy can help the patients to develop a coping skills and manage their stress and anxiety. Also, family therapy can be effective for it. Also, cognitive behavior therapy can also be effective for the patient who is diagnosed with factitious disorder. Also, medication may be used to treat and other additional mental disorders such as anxiety, depression, etc. About the treatment for malingering. So there is no specific treatment for malingering. So in this case, exposure is a primary gain for the clinician. When a practitioner suspects that someone is malingering, they should consider a range of factors before making a final determination. So, whether their story is incongruent with the known symptoms, or whether they are cooperative while evaluation, and whether they have legal problems or financial gain for the diagnosis. Also, psychological evaluation is also recommended for detecting malingering. So, that's all about factitious disorder and malingering. Thank you.